Okay, I'm with Lynn at Quality Dental Care. And a couple months ago, Lynn and I spoke for a few minutes about using a new tool, and she is the treatment coordinator here at the office, so is in charge of kind of just discussion as well as financial points with the patients. And the tool we were talking about using is the patient case portfolio. So just wanted to find out from Lynn how she's been using that in the last few months and to what effect it's had. Lynn, start off, just what's the process like when the patient is finished up in the clinical environment as they come your direction?
Well, once a patient actually comes up front, the hygienist actually hands them off to me. What happens is the hygienist will tell me, okay, the patient and the doctor and I have discussed, and this is kind of what we see going on, whether it's crowding, crossbite, or what's going on, and she just hands them off to me at that point in time. Once we get to that step, I just tell the patient, okay, we're going to have Patty write up this treatment plan for us so we can, go over the fees. But in the meantime, I just kind of wanted to show you something that's really cool that Invisalign goes on. What Invisalign normally does is when we take the impressions, we send the impressions off, and we give that to Invisalign to do like a 3D model. So then the patient's like pretty interested and excited to know the fact that they'll be able to see kind of a 3D model. So I show them before and after photos depending on what their case is based off of what the hygienist tells me. Once I go through before and afters, then I show them the 3D version of the ClinCheck, and by that point in time the patient's pretty excited and then ask me, will that be me when I do this? I said correct. Once we do the impressions, they'll upload that, we'll be able to show you, where you're going to be starting to where you're going to be ending for perfect treatment.
So show me an example or two of some of the case studies or the presentations that you use most commonly as you're being handed that patient from the hygienist, if you would, please.
Perfect. Most of the time, what I normally use a lot of the time with patients that we have is the crowding is the most typical. So I'll just tell them, here's a similar case. Here's a patient who has moderate crowding similar to what you have. Here's the before and after photos of a patient who's smiling. Then I kind of go just step by step. I say, now here's the profile. You can definitely see how it changes the profile from before to after, as well as just kind of when they're not smiling there. Then I go to the different arches, show them, hey, here's the before, now here's your after, similar situations that you have, kind of explain to them whatever teeth that they have that could be crowding. I explain to them, you see how that one's there, it's going to shift similar to this. Just kind of go through each slide. Again, show them the top and the bottom. And I go to the views and show them, you see how all this is going on, where you have the crowding here, or whether it's the lower teeth or the anterior, if everything's overlapping. And then show them, basically all the photos. And then I tell them, the nice thing that we have is the ClinCheck, it's the 3D model, where it'll show you the start to the finish of how everything's looking. I show them, obviously the whole case here, and then I definitely go to the lowers and the uppers, especially if they have different, crowding on top or the bottom, and kind of show them how everything is shifting and would shift for them. At this point in time, the patient's super ecstatic because they want to, see what theirs would look like. They do have questions sometimes. Sometimes they don't. Just kind of depends. A lot of their questions is answered because they don't understand first how plastic trays can actually move their teeth. When they see the stages that they go through here to show from the start to the finish, and then I let them know, okay, the duration for this patient was 14 months, they're pretty excited to realize, oh, it's not going to be the 3.5 years or more like traditional would be. By that time, they're pretty ecstatic. So it just comes down to then the money-wise. A lot of questions I do get after I show this is, wow, that's pretty neat, but that probably costs a heck of a lot more because, traditional doesn't do this. Well, then I tell them, actually, you're not right there. Traditional is more expensive than Invisalign is now.
Very good. So during this time that you're showing them the case examples, you say that Patty is working up a treatment plan, and it has allowed enough time now that you have those numbers in front of you. And then do you find that bit of interest level that you've increased has led to more patients accepting that treatment plan?
Correct. The patient and I will actually have a nice conversation here because they actually step over to my desk and they are one-on-one with the computer with me. I don't turn it around. They're, in my little element. So once they're kind of in the element, it's a one-on-one conversation. They feel very comfortable. They ask lots of things. They ask with me being in it. And with me being in traditional versus Invisalign, which gives Patty plenty of time to write that up. So by the time our conversation's done and I've answered all their questions that they have asked, I'll be able to go grab that and I just say, okay, well now that we're done looking at this, if you don't have any further questions, we'll grab the treatment plan from Patty, we'll go over the different fees and kind of go from there. So that by that time, then they walk around here, go grab that, we go through all that, we find something that works good for them, and then I find out that patients are more willing to accept the treatment because for one, they know that it is actually cheaper than traditional based off of our conversation, and two, they can see the progress that there will be, and it's less time.
Right.
So since I've been using this, I've had a lot more patients that are actually accepting it.
Well, and to note, Lynn, since Lynn started using this tool a couple months ago, they have had 9 accepted cases in just those 2 months. So a tremendous increase in their case volume, and
2 more scheduled this week.
fantastic.
So
Well, well done.
It's a huge tool to use. It's beneficial. I didn't at first. I'm not gonna lie. I was very hesitant on using it when Eric told me, "Okay, let's try using this." I'm like, when am I gonna have time? Now it's just become a routine. I mean, the hygienist brings them up. This is what they tell me from that moment in time. We look at this, gives Patty plenty of time, and then it just kind of all flows to where there's no standing around for them to kind of hesitate about whether or not they want to do treatment. This whole time they're very active and engaged and want to do it. So by the time the fees come around, it's not even an issue anymore.
All right. Well, thank you so much, Lynn. I appreciate your effort.
Thanks.
Okay.